How's everyone doing? My name's Harry. I'm a paramedic technician here at ihealth, and I'm going to go over with you the products that come in your HRT kit and how to take them and dispose of the needles properly. It's a real simple procedure. Once you go over it a few times, you'll understand the concepts, and it'll be very simple. So don't let all the items here intimidate you that it's a complex process. It really is not. For this, as a technician, I'll be wearing gloves. So you at home, make sure your hands are washed thoroughly before you handle the products, because you don't want to introduce bacteria or any kind of foreign substances into the needles or anything you handle, and then cause a chance of you having an infection or becoming ill. So make sure you wash your hands properly. Okay, so we'll start with the simple basic one, which is the Anastrozole, and basically that's going to come into a little pill, and what you're going to do is once a week you're going to take one out. And according to what the doctor says, you'll either take a whole one or you'll take half of one once a week or twice a week, depending on how he prescribes it for you. You get a pill splitter and have that split. It's a very tiny pill, but it's very effective. So you'll go ahead and take that once a week, and just mark your calendar to take it the same day of the week all the time. Okay, so that's the Anastrozole. The next thing we have here will be either your HCG or your gonadadrelin. And that is going to be delivered sub-Q. And what that means is it's going to go just under your skin into your fat layer of your body. It's not going to go IM or intramuscular. You want this out of the muscle, not in the muscle. And that's why it has a very small, what we call an insulin needle, which is a very tiny, fine needle. So we'll prepare that now. Now, whenever handling any kind of vial where you're going to introduce the medicine into your body, you want to make sure everything is clean and sterile. Okay, so what you're going to do is you're going to grab the alcohol swabs, and this will be provided in your kit. You're going to take the swab and you're going to rub it to where the needle is going to penetrate into the vial, and you want to rub it, and you want to rub it no less than 15 seconds. Up to 30 seconds is ideal. So you want to make sure, and that's nice and sterile and clean, because when this sits in your drawer, all sorts of dust and bacteria and anything could just land on it. You don't want to introduce that. So you'll do that. Then you'll get your needle prepared. Now what you're going to do is, sometimes these vials, they'll have a vacuum in it, or there'll be a static pressure in there. So you don't want to just keep drawing fluid and not introduce air, because then it'll be harder and harder to draw the medicine out every time you inject. So what you're going to do is you're going to pull back on your syringe or your needle to the amount of medicine you're going to be injecting. So for this instance, if we're going to do a half of ml, I'm going to pull it back to 0.5 on the incident needle, and it's marked there. On some, they're marked as units, not mLs. So a unit would be 100 units, which is 1 ml. So on a syringe like this, it'll say 50 units, which is 0.5 mLs. So don't let that confuse you either. You'll go ahead and take the cap off. Keep the cap available, because now that the top is sterile, you go ahead and put it in the center. You'll insert the air, upright the vial, and then slowly draw back on the syringe. To the level you want, right there, 0.5. Upright the vial so you don't spill any of the medicine, and then go ahead and recap your needle, and now it's prepared, ready for injection. Okay, so now we're going to go over the third medication in your kit, which will be your testosterone. Again, it'll be dependent on what's available at the pharmacy and what Dr. Everett will recommend for you. So either way, the drawing of the medication and the application is going to be is going to be the same as it was for the gonadadrelin. So with your alcohol swab, you're going to clean up the top of your vial 15 to 30 seconds rigorously. You want to make sure that's nice and sterile. And then while it's resting, you're going to go ahead and open up the syringe your kit comes with. So you're going to have the syringe you're going to draw with and the syringe you're going to inject with, which is going to be two different size needles. And you'll be able to identify that is on the packaging. You'll see the gauge, which will be marked with a G. So this particular one is a 25 gauge. And just so you understand, the larger the needle, the larger the gauge, the finer the needle. Okay, so when we talk about using a larger needle to draw, the number is going to be smaller. So depending on what you're going to have in your kit. So this particular one, here we go, will come with a 21 gauge needle, and that's what we're going to use to draw with, and then you're going to inject with a 25 gauge needle. Okay, and I'll demonstrate how to switch that over. So your needles should be sterile, so they'll all be in packages. If your needle's not in a package, do not assume it's sterile, throw it out. Make sure you get one in a package. Okay, so now you remove your cap, and we talked about earlier about introducing air into the vial before we draw our medicine. So in this case, we're gonna pull out 1 ml, and that's indicated on the syringe at 1 ml. So we're gonna introduce 1 ml of air into our vial. Now you can see how large of a bore that needle is. Now you could use it, but it won't feel good. You definitely feel that pulling. So you push in the air, you hold your vial upright, you make sure the head of the needle is in the fluid and not above too high to where you're gonna draw air again. So you're in the fluid, and you're gonna draw back, and you're gonna see your syringe as you draw on the plunger, fill it up. There you go. You're going to get to the 1 ml mark, which will be the top of the plunger. Where the top of the plunger is, that's your volume. You invert it, pull it out, and then carefully with 2 hands, insert your needle. Probably a safer way to recap that needle is to lay the cap down, insert the needle into the cap, and then cap the needle. Now you get your injecting needle, and that'll already be pre-capped. You'll twist the needle on there like that, and twist on the new needle, and so that's going to be your new needle for injecting. Right there. Now, when we have needles, whether they're penetrated the skin or not, we're going to assume they're all contaminated, and all contaminated needles need to be placed in a biohazard type container that's puncture proof, and that'll come in your kit as well. This is what will come in. It'll come in a box. It may be this brand or another brand, but what you can do is you can open it, and it comes already the cap and cover on it. And it's going to have slots where only you can put the needle in there. So what you're going to do is you're going to take your used needle and you're going to drop it in there. And then that's where you're going to put all your needles. Now after you inject your medicine, what you could do is, to save space, you can always take your needle off, dispose of your needle, and now your syringe isn't contaminated, isn't made of glass, it won't puncture anything. This can be thrown out in the trash. But your needles, anything with a sharp on it that's been contaminated, basically punctured your skin, needs to be inserted into this biohazard container.